Hi, and welcome to Ferrara Services. I am Michael Ferrara, and today we are going to talk a little bit about Original Medicare and how to enroll in Part A and Part B, along with what is covered and what's not covered with your Part A and your Part B. So let's go ahead and get right into this. So what is Original Medicare? Original Medicare is coverage managed by the federal government. You generally have to pay a portion of the cost for each service covered by Original Medicare. Original Medicare is Part A and Part B. Part C is not part of Original Medicare, and it's run by private insurance. Part D is your prescription drug coverage. So as we mentioned, there's 4 different parts. You have your Medicare Part A, which is going to be your hospital insurance, and that's going to help cover inpatient care in hospitals, skilled nursing facility care, hospice care, home health care. Your Medicare Part B is going to be your medical insurance. This is going to cover services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment, and some preventative services. Your Medicare Part C is your Medicare Advantage plans. This includes all benefits and services covered under Part A and Part B. Usually includes Medicare prescription drug coverage, which is your Part D, as part of the plan. It's run by Medicare-approved private insurance companies. This is important. It's run by private insurance companies. So they're going to dictate what's covered and what's not, whereas your Original Medicare, your Part A and Part B, is going to be dictated by your doctors. Now, your Medicare Advantage plan may include extra benefit and services for an extra cost. Your Medicare Part D, which is your Medicare prescription drug coverage, this helps cover the cost of prescription drugs. It's run by Medicare-approved private insurance companies. It may help lower your prescription drug costs and help protect against higher costs in the future. Now, you may be automatically enrolled in Medicare. If you're already getting benefits from Social Security or the Railroad Retirement Board, which is RRB, you'll automatically get Part A and Part B starting the first day of the month you turn 65. If your birthday is on the first day of the month, Part A and Part B will start the first day of the prior month. If you're under 65 and disabled, you'll automatically get Part A and Part B after you get disability benefits from Social Security for 24 months or certain disability benefits from the RRB for 24 months. If you're automatically enrolled, you'll get your red, white, and blue Medicare card in the mail 3 months before your 65th birthday or 25th month of disability benefits. If you're going to wait to get Part B, follow the instructions that come with the card and send the card back. If you keep the card, you keep Part B and will pay Part B premiums. So that's very important. Now, if you're close to 65 but not getting Social Security or railroad benefits, and you want Part A and Part B, you will need to sign up. You're going to contact Social Security 3 months before you turn 65. You can also apply for Part A and Part B at socialsecurity.gov/retirement. If you work for a railroad, contact the RRB. If you have end-stage renal disease, ESRD, you'll need to sign up. Contact Social Security to find out when and how to sign up for Part A and Part B. Now, if you're not automatically enrolled, where can you go to sign up? In most cases, if you don't sign up for Medicare when you're first eligible, you may have to pay a late enrollment penalty for as long as you have Part B. You're going to have an initial enrollment period. You can sign up for Part A and or Part B during the 7-month period that begins 3 months before the month you turn 65, includes the month you turn 65, and it's going to end 3 months after the month you turn 65. If you enroll in Part A and or Part B the month you turn 65 or during the last 3 months of your initial enrollment period, the start date for your Medicare coverage will be delayed. You're going to have a general enrollment period, which if you did not sign up for Part A and or Part B, for which you must pay premiums, during your initial enrollment period and you aren't eligible for a special enrollment period, you can sign up between January 1st through March 31st each year. Your coverage will begin July 1st of that year. You may have to pay a higher Part A and or Part B premium for late enrollment. You're also going to have a special enrollment period. Once your initial enrollment period ends, you may have the chance to sign up for Medicare during a special enrollment period. If you didn't sign up for Part A and or Part B when you were first eligible because you're covered under a group health plan based on current employment, your own, a spouse's, or if you're disabled, a family member's, you can sign up for Part A and Part B. Usually you're not going to pay a late enrollment penalty if you sign up during a special enrollment period. This special enrollment period does not apply to people with end-stage renal disease. Now, COBRA coverage and retiree health plans aren't considered coverage based on current employment. You are not eligible for a special enrollment period when that coverage ends. To avoid paying a higher premium, make sure you sign up for Medicare when you are first eligible. Now, should you get Part B? Employer union coverage. If you or your spouse or family member, if you're disabled, is still working and you have health coverage through that employer or union, contact your employer or union benefits administrator to find out how your coverage works with Medicare. You can sign up for Part B without paying a penalty anytime you have health coverage based on your or your spouse's current employment. COBRA and retiree health coverage don't count as current employer coverage. Once the employment or coverage based on your current employment ends, whichever happens first, three things can happen. You have 8 months to sign up for Part B without a penalty. This period will run whether or not you choose COBRA. If you choose COBRA, don't wait until your COBRA ends to enroll in Part B. You may be able to get COBRA coverage, which continues your health insurance through the employer's plan, in most cases for only 18 months, but probably at a higher cost to you. If you already have COBRA coverage, when you enroll in Medicare, your COBRA will probably end. If you become eligible for COBRA coverage after you're already enrolled in Medicare, you must be allowed to take the COBRA coverage. If you choose COBRA, it will always be secondary to your Medicare, unless you have end-stage renal disease. When you sign up for Part B, your Medigap open enrollment period begins. Now, your Part B premium, which it was in 2014 was $104.90 a month, and it stayed the same for 2015. Now, you're going to have penalties for not signing up for Part A or Part B, and those penalties are going to be your monthly premium may go up 10% when you decide to enroll. You'll have to pay the higher premium for twice the number of years you could have had Part A but didn't sign up. Part B, you may have up to a 10% for each full 12-month period that you could have had Part B but did not sign up for it. This is paid as long as you have Part B. So what does Part B cover? Medicare Part B, which is also medical insurance, helps cover medically necessary doctor's services, outpatient care, home health services, durable medical equipment, and other medical services. Part B also covers many preventative services. Under Original Medicare, if the Part B deductible applies, you must pay all costs up to the Medicare approved amount until you meet the yearly Part B deductible, which is $147, before Medicare begins to pay its share. Then after your deductible is met, you typically pay 20% of the Medicare approved amount of the service if the doctor or healthcare provider accepts Medicare. There's no yearly limit for what you pay out of pocket. So you're going to pay the first $147 a year for your Medicare Part B. Then after that, you're going to pay 20%. Medicare is going to pay 80%. There's no ceiling on this. So as long as you get services and it's covered under that Part B, Medicare will continue to pay 80% and you're going to continue to pay 20%. Now you can't offset this with the Medicare supplement plan, which we'll talk about in another video. So if you have any questions about that, please feel free to ask. So what's not covered by Part A and Part B? Medicare does not cover everything. If you need certain services that aren't covered under Medicare Part A or Part B, you'll have to pay for them yourself, unless you have other coverage, which includes Medicaid, to cover those costs. You're in a Medicare health plan that covers these services. Again, that's a Medicare Advantage plan. Even if Medicare covers a service or item, you generally have to pay deductibles, coinsurance, and copayment. Some of the items and services that Medicare does not cover includes your most dental care, eye examinations related to prescribing glasses, dentures, cosmetic surgery, acupuncture, hearing aids, and exams for fitting them. It's also not going to cover any long-term care. What happens when employment coverage ends? We went over this a little bit in the beginning, but I wanted to go over it one more time. Again, you have 8 months to sign up for Part B without penalty. If you choose COBRA, do not wait for this period to end to enroll in Part B. You may be able to get COBRA, which continues your health coverage through the employer's plan. In most cases, again, it's only going to go 18 months, but it's probably going to be at a higher cost than what you would be paying for your Part A and Part B with Medicare. When you sign up for Part B, your Medigap open enrollment period begins. This is your Medicare supplement plan. This is important. And again, we'll go over this in another video, but a supplement plan can offset all these costs for you. So Medicare and other insurance. When you have other insurance like employer group health coverage, there are rules that decide whether Medicare or your other insurance pays first. Please see the chart on page 28 of your Medicare and You handbook, which I will show you here real quick. So here is your Medicare and You handbook. You should get one of these in the mail each and every year. So moving on here. So we briefly went over Part A and Part B, and a little bit over how to enroll in Part A and Part B. And I just want to thank you for watching. I do appreciate your time. And I understand when your open enrollment comes and you're just turning 65, this can be overwhelming information. You're going to get a flood of information in the mail. You're going to get postcards from everyone saying, sign up for this, sign up for that, and it's going to be very confusing. That's why we're here. As consultants, we're going to sit down with you, help educate you on the best possible options, whether it's Part A, Part B, which is original Medicare, and then combining that with the Medicare supplement plan, which when you first turn 65, that's the best time to purchase a Medicare supplement plan. And we'll go through the different plans, A through N. You're going to have your Part D, which is prescription drug. Now the best way to do that is call 1-800-MEDICARE. That's going to be the best way to purchase your Part D. And the trick is call late at night. They're open 24 hours, but there's not going to be a huge wait for you on the phone. And then you have your Part C, which is your Medicare Advantage plan. Is that option open to you? Is it something you might want to consider? We can go over that. So again, my name is Michael Ferrara. I appreciate you watching. I appreciate your time. And if I can be of help, please let me know. But thank you so much, and I hope you guys have a great day. Thanks for watching.